Understanding sleep disorders, impact, prevention, and management across all ages. Sleep disorders are conditions that affect the quality, amount, and timing of sleep you are able to get at night. Common sleep disorders include insomnia, restless leg syndrome, narcolepsy, and sleep apnea. Sleep disorders can affect your mental health and physical health. Treatment is available to help you get the rest you need. What are sleep disorders? Sleep disorders are medical conditions that disrupt your normal sleep pattern. They can affect how long or how well you sleep, leading to daytime tiredness, poor concentration, mood swings, and long-term health problems. Everyone, from infants to the elderly, can be affected. Sleep is vital for brain function, physical health, emotional well-being, and overall quality of life. Types of sleep disorders. Insomnia, difficulty falling or staying asleep. Sleep apnea, breathing repeatedly stops and starts during sleep. Narcolepsy, sudden, uncontrollable episodes of deep sleep. Restless leg syndrome, RLS. Uncomfortable sensations in the legs with a strong urge to move them. Parasomnias, abnormal behaviors during sleep like sleepwalking. Night terrors or talking. Circadian rhythm disorders, disruption of the internal body clock, e.g. shift work disorder, jet lag. How sleep disorders affect different age groups. Infants and toddlers. Common issues, irregular sleep patterns, frequent night awakenings. Effects, irritability, delayed development, poor feeding. Causes, feeding habits, teething, inconsistent routines. Children and adolescents. Common issues, night terrors, sleepwalking, bedwetting, delayed sleep phase. Effects, poor academic performance, hyperactivity, mood swings. Causes, screen time, anxiety, school stress, lack of bedtime routines. Adults. Common issues, insomnia, sleep apnea, stress-related disorders. Effects, fatigue, poor work performance, irritability, weight gain. Causes, work stress, lifestyle choices, poor sleep hygiene, anxiety, caffeine. Older adults. Common issues, light sleep, frequent awakenings, early waking. Effects, memory problems, depression, falls, reduced immunity. Causes, aging brain, medications. Chronic illnesses, e.g. arthritis, heart disease. How much sleep do I need? Everyone needs sleep. It's an essential part of what makes our bodies function. The amount of sleep you need might be more or less than others, but experts recommend adults get 7 to 9 hours of sleep per night. Optimal sleep time varies by age. For example, children and teenagers may need more sleep than adults. Consequences of poor sleep: weakened immune system, high blood pressure and heart disease, diabetes risk increases, mood disorders, depression, anxiety, poor memory and concentration, accidents and injuries, e.g., while driving or at work. Prevention of sleep disorders: stick to a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Kindly watch with kind interest and make sure you watch to the end. How common are sleep disorders? More than 50 million people in the United States have a sleep disorder. In addition, more than 100 million Americans of all ages report that they don't get an adequate amount of sleep. Symptoms and causes. Causes of sleep disorders can include an underlying condition, neurochemical imbalances, and genetics. There are several possible causes of sleep disorders, all of which disrupt your sleep-wake cycle. What are the symptoms of sleep disorders? Symptoms of common sleep disorders vary based on the type, but could include difficulty falling asleep, or it takes more than 30 minutes to fall asleep regularly, trouble staying asleep through the night, or you wake up often in the middle of the night and can't fall back asleep. Snoring, gasping, or choking happens during sleep. Feeling like you need to move when you relax. Movement relieves this feeling. Feeling like you can't move when you wake up. During the daytime, you may experience additional signs and symptoms caused by a lack of adequate sleep, including daytime sleepiness, taking frequent daytime naps or falling asleep while doing routine tasks, behavioral changes like difficulty focusing or paying attention, mood changes like irritability and trouble managing your emotions, difficulty meeting deadlines or performance expectations during school or work, frequent accidents or falls. If you feel like you're not able to get a good night's rest, or have symptoms that interfere with your daytime activities, talk to a healthcare provider. What causes sleep disorders? A disruption to your body's cycle of sleep and daytime. Wakefulness causes sleep disorders. Specific things may cause this to happen, and it varies based on the type of sleep disorder you have. They may include a symptom of a medical condition like heart disease, asthma, pain, or a nerve condition, a symptom of a mental health condition like depression or anxiety disorder, genetic factors and mutation, a side effect of a medication, working the night shift, substance use before bedtime like caffeine or alcohol, low levels of certain chemicals or minerals in the brain, an unknown cause. What are the risk factors for sleep disorders? You may be more at risk of sleep disorders if you have an underlying health condition, experience stress, work late shifts, have a history of sleep disorders in your biological family. Research suggests that females are more likely to experience sleep disorders than males. In addition, about half of all adults over the age of 65 have a type of sleep disorder. Management and treatment. Lifestyle changes. Maintain a regular sleep routine. Limit alcohol and caffeine. Engage in daily physical activity. Use the bedroom only for sleep and intimacy. Medications under medical supervision. Melatonin for circadian rhythm disorders. Sedatives or sleep aids, short-term use only. Sedatives or sleep aids, short-term use only. Medication for underlying causes, e.g., antidepressants, anti-anxiety drugs. Cognitive behavioral therapy for insomnia, CBTI. Helps identify and change thoughts and behaviors that cause or worsen sleep problems. Considered more effective than sleep medications for long-term management. Treatment for specific disorders. Sleep apnea, CPAP, continuous positive airway pressure machines. RLS, iron supplements or medications to reduce limb movements. Parasomnias, safety measures, stress reduction, and in some cases, medications. When to see a doctor. You consistently feel sleepy during the day. Snoring loudly or gasping for air while asleep. Trouble falling or staying asleep for more than 3 weeks. Nightmares or abnormal behaviors during sleep. Quick tips for better sleep for all ages. Age group tips: infant swaddling, feeding before bed. Soft lullabies, children, no screen time before bed, bedtime stories. Night light if scared, teens limit late night phone use. Regular school sleep schedules, adults avoid late night stress. Schedule wind down time, seniors more morning sunlight exposure. Manage medical conditions. Final thoughts. Sleep is not just rest, it is healing, restoration, and growth. From birth to old age, our brains and bodies rely on sleep to function at their best. Recognizing and addressing sleep disorders early can greatly improve overall well-being and prevent serious health problems.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.